October is Breast Cancer Awareness Month, and even though organizations like the American Cancer Society say remarkable progress has been made against the disease, we still have a ways to go to find a cure and to wipe out the invasive disease. In the U.S. alone, 1 in 8 women will be diagnosed with breast cancer in their lifetime, and in 2018, approximately 266,000 new cases have been diagnosed, and as many as 41,000 women will pass away. Today, we are addressing the angle of the effects of breast cancer and chemo on younger patients' ability to get pregnant. Joining us is Alona Metz, an American breast cancer survivor whose battle to salvage her eggs has a happy ending thanks to a well-regarded Israeli fertility doctor who's using a progressive procedure to increase Alona's chances of getting pregnant. Please welcome Alona Metz and Dr. Hila Raanani of Sheba Medical Center's Fertility and Preservation Center. Welcome both of you to the show. Welcome back to you. First, tell me, you were diagnosed in 2012. You were still living in LA at the time, at a time that you're not thinking about having kids. So when you got this diagnosis, what was it like to realize that now this is something you have to worry about?
Yeah, I mean, as you said, I was 28. At the time, I was a lawyer. It wasn't even on my radar having kids. And all of a sudden, within 1 week, I was told, you have breast cancer. You're going to have to do chemotherapy. You're going to lose your hair. You're going to potentially lose your breasts. Oh, and by the way, you might not have to be able to have children after this is all over. And I felt like suddenly, because that door was potentially being closed, this almost instinct took over me that I had to do something about it. Mm-hmm. So yeah.
And you tried to freeze some eggs to save, and it was not a successful outcome for you.
Well, in the beginning, they told me they didn't want me to do anything because they wanted to start chemo right away, and I insisted that I had to do at least 1 cycle to try to freeze some of my eggs before doing chemotherapy. I just needed that peace of mind. And unfortunately, it was not a very successful procedure. I did have some eggs, but it was, for my age range, it definitely wasn't what would be considered a good chance of getting a pregnancy afterwards. So it was hard.
I mean, it's hard enough dealing with breast cancer, let alone this. So for you, Dr. Raanani, what is it about, the effects of chemo and other, ways to fight, cancer that affects our eggs? What is the science behind it?
So there's a lot of implication of the whole situation. It's not only the oncologic therapies. First of all, it's time-consuming, and talking about fertility, time is the most biggest asset that we have in fertility science. So we are actually losing time. These women are diagnosed, and then they are going through treatments, and afterwards they're expected to postpone their fertility plans for at least 2 years. Sometimes it takes much more. So you find yourself, if you were 28, you can find yourself, if you're 32, you're still single, and after chemotherapy, which has effects on the fertility, to actually destroys much of our egg pool.
Yeah, which
nature does anyway.
Yes. So for you, you had, you have a happy ending. You've met your fiance, and now you're able to do it kind of as a couple. So how has, seeing, Dr. Raanani, changed your life?
Yeah, so I'm now 34, and I started thinking about trying to do another cycle to get some of my eggs, also because I carry the BRCA gene mutation, as well as some other fun genetic mutations. And so I may also do something called PGD, which is selecting only embryos that do not carry those genetic deficiencies. So I tried doing this procedure again after chemotherapy at the age of 34. The first time I did it, it was even less successful than before I did chemo, and it was really devastating. And yeah, I have a fiance now, so we actually decided to do it one more time together, and that's when I did it with Dr. Raanani, who was recommended to me by another young woman who had been through a very similar situation.
Right, and so, she really made a difference. Yeah. Tell us quickly about what's unique to Sheba. You guys are doing a procedure where you're actually able to take out full ovaries. Are you finding that actually ensures more eggs down the road?
This is not the procedure Alona went through. It's less used in breast cancer patients, but it's freezing ovarian tissue. This we do when we're facing real gonadotoxic therapies like in bone marrow transplantation, and it's more referring to other oncology situations, but also we have breast cancer patients that have done it. We actually do a surgery which we call laparoscopic surgery, and we take half of one ovarian tissue, we freeze it. And it can be used only autologous for these women that froze it. When she gets healthy, if she cannot conceive by herself, after we used all the tools we have, we transplant it back. So now it's this technique is established all over the world.
Amazing. Israel, pioneer in science. Thank you both for coming.